Namaste and good afternoon everyone. I'm Dr. Vishnu GADE, Consultant Neuropsychiatrist at Kamineni Hospital, Koti in Hyderabad. So today's topic is managing strategies for depression and anxiety. So as a psychiatrist, I see a lot of cases with depression and anxiety, and it is on the rise from the past few years. Now, the topic for today is strategies to manage. So I'm going to give you a brief introduction to the concepts of depression and anxiety, so it can help you understand what it is. And if you're suffering from the above two conditions, you can definitely seek help from a hospital. So depression is a chronic state of mind where the person feels sad, lonely, and there's decreased pleasures, etc. So for the criteria for depression is a person needs to be sad for the most part of the day, continuous, like for many days or weeks, and there will be a loss of interest in pleasurable activities such as work, family, social interactions, etc. There might be also physical weakness, mental exhaustion, and the patient may not be able to do the works as completely as before. The tasks that he's doing these days might be having a lot of errors. He might not be up to the mark at the workplace or school, etc. Sleep is affected. The patient might sleep less than before. In some conditions such as atypical depression, the patient may be oversleeping. Appetite is decreased. Sometimes people overeat to compensate for the sad mood and loneliness. And negative feelings, overthinking, negative thoughts, worried about the future, pessimistic or bleak thoughts, as we say, where they are worried what will happen tomorrow or in the coming few weeks. The main thing that we as psychiatrists are worried about is when the patient has extreme negative thoughts such as harming himself, which we call as deliberate self-harm, and also suicidal thoughts. The patient might be pushed to committing the act where he feels that he has no hope and there is no one around him and he is sunk in a hole and he cannot come out. So these things kept in mind, we can assess the patient, and we have certain diagnostic psychometric tools or rating scales which we use on the patients, and then we can assess them and grade them based on the severity. We can grade them as borderline, mild, moderate, severe, and extreme. So the patient may have some of the features as I mentioned, or all of them, or just one or two. But addressing them at an early stage is very critical. We should not let these symptoms evolve and manifest into a darker form if left untreated. So coming to anxiety. Anxiety is a state of mind where the brain is under stress and it gets alert, and it prepares the person for the upcoming state of alertness and tension or nervousness. And the person is anxiety is a normal reaction. Everyone faces it. But if it is long lasting and the patient is getting affected with it, his performance physically and mentally is getting affected, and that is when the condition needs to be addressed medically, and that is where we as psychiatrists and psychologists come in. Now, anxiety has many forms. There are many subtypes in it. For example, just a brief, there might be social anxiety, performance anxiety. Children have selective mutism in school, and separation anxiety, such phobias such as fear of heights, fear of planes, fear of closed spaces such as being stuck in an elevator or a dark room. All these state of mind do cause anxiety levels to increase. Now anxiety shows up in physical manifestations where your body shows the reactions to the stress as well. Your hands might be shaking, trembling, increased sweating, dizziness, nausea, a little bit of vomiting sensation might be there in some people. You cannot focus well, you cannot concentrate, you don't know what's happening, your heart is beating fast, you are breathing fast. Sometimes you feel like you are choking and you're suffocating. In that panic episodes attack, we need to understand that nothing's going to happen. So reassurance is important, and yes, everything subsides over time. But if this condition is going on being chronic for weeks and months together, then you definitely need to seek professional help. Now, coming to the strategies for this. Depression and anxiety are separate components, but sometimes they might be overlapping each other as well. There might be other conditions as well which are part of the spectrum. So what we need to understand is depression or anxiety can occur to anyone, age, sex, creed, financial status, even sexual orientation, be it straight, heterosexual and homosexual or transgender. Everyone can get affected with this equally. It can occur at any age as well, as young as 7-8 years, from school going children to adults, and it can also go till geriatric population, the old people such as even 90 plus. It can happen at any time based on certain conditions. Now it can be genetic, psychosocial, environmental stress like school stress, college, family marital stress, workplace, office, kids, and also in a geriatric population we see major thing which is loneliness, lack of family support, lack of financial support from the children to the parents side, etc. So all these factors, multi-factorial in a way, they affect the person. So what can we do to help you? Now we look at this in three parts: medical, that is psychopharmacological treatment, that is medications that we do; then psychological treatment with therapies such as talk therapies and counseling that we do. The third is self-help techniques that we teach the patients what all they can do at home or in a day-to-day life to help themselves get better. So the medical treatment is, when you come to us, the doctors in the hospital, we do all the basic tests. We do the blood workup and we send to the general medicine department as well, because most of the times there might be underlying conditions that might be missed. For example, diabetes, hypertension, thyroid, and all these factors do play a role in depression as well. So that needs to be ruled out. And then we take up the case as once everything is clear from their department, when the patient comes to the psychiatry department, we do the psychoanalysis and we do the rating scales where we grade the patients based on their disorder, and then we come to a provisional diagnosis, and then we have a treatment plan from them. Then we can also have a psychologist or a therapist attached who can teach you techniques such as CBT therapy, which is cognitive behavioral therapy, where negative thoughts which affect the person are converted into positive ways, and the thoughts are converted into positive thoughts. How do we do that? Is with the repeated sessions and constant training. Psychoeducation of the patient is done, even the family members is done. For example, if a child comes to us with anxiety, we need to understand what is the root cause of it. Is it some stress at school? Is someone bullying him? Is the teacher too strict with him? Or is there any physical assault somewhere? Or even sexual molestation, which needs to be ruled out, like for example good touch, bad touch. These concepts are not known to the young children, so there is a way where we ask them in a comfortable and safe environment, and then these target regions are addressed. So there is also dialectal behavioral therapy, interpersonal therapy, and ACT, acceptance and commitment therapy, etc., which I won't be going into detail with. Coming to the self-help thing, what I tell my patients is, first analyze yourself, what the issue is, which areas you feel we can help you with. So maintain a thought journal or a mood journal where you can note down on a day-to-day basis how your day was, what was the good thing that happened in a day, what was the bad thing that happened in a day, and how you were feeling during that current episode. Were you having extreme negative thoughts, or was it just thoughts which were manageable and you felt good after 1 hour or just 10 minutes? And then this exercise needs to be continuous. What I reassert with my patients is mental illness is not something that can go away or be treated in 1 week or 2-3 weeks. It's a long process where it might take 2 months, it might take 6 months, but yes, the patients do recover, but we need commitment, number one, from the patient, and number two, we need commitment from the family members or friends or whoever the loved ones are, because already the patient is feeling lonely, and when there is no support, emotional support, not financial, emotional, physical support from their families and friends, then the person already who is suffering with depression is more depressed. So we seek for help from family. Then next, what you can do is encourage social interactions. Be more proactive in the social section. I know patients who are depressed, they might say, sir, I'm already depressed, I don't want to go out, I'm happy in my own room, I'm scared to go out. But that is where you're wrong. When you are addressing a condition, you have to face it head on. Being in a room is not going to solve anything. I might put you on 2-3 tablets and you might get 20%, 30% better, but at the end of the day, coming out and addressing those conditions and facing them head on, for example, social anxiety, stage fear, etc., will help the condition be resolved even quicker, and that will help me as a therapist better. The other thing is exercise, regular exercise, not daily basis, weekly 2-3 days is good enough. Cardio, which is cycling, treadmill, light jogging, that can be helpful. You can do it alone, or you can do it with kids or like family friends. Research has showed that when a mother exercises regularly with the children positively learn from their mother, and they also incorporate exercise into their daily lifestyles. Second, decrease the social media. Now it can include whatever, using the laptop, phone, Facebook, Instagram, etc. Try cutting it down. Negativity is fed from social media, which is not good for the people who are already depressed. They already have negative thoughts, and seeing someone portray something like, I'm having a lavish lifestyle, it's so easy for me, do it, anyone can do it. Yes, anyone might do it, but at this condition the patient they might not be in that current place, but seeing that they already have very low confidence, self-esteem, they might be affected a little bit more. Now, maintain healthy sleep timings, at least 6 to 8 hours a day is good, proper sleep. Patients who have trouble sleeping, we put them on medications as well for a short term, so that the sleep cycle, the rhythm is fixed, and then we take them off. A common myth that patients ask me is, doctor, I'm going to use the medication, but is it going to be addictive? Am I going to be addicted for it for lifelong? No. All the drugs or the medications that I'm going to put my patients on, they're going to be carefully monitored. I'm going to dose them based on their age, the weight, and everything considered, and then we try for a short course, then for weeks, and then based on the improvement, along with the cooperative therapy from cooperative method from the psychologist and the therapist, the holistic treatment that we give here at Kamineni, the patient can get better sooner than just on monotherapy. Now, foods is also a good source. We call them serotonin-rich foods, which improve the serotonin chemical neurotransmitter, which is basically the, in layman's term, happy hormone. So the foods that you can take or incorporate into your diet, which will help increase the serotonin levels, is number one, bananas, green leafy vegetables such as spinach, milk products such as cheese, yogurt, curd, and cow's milk. In dry fruits, we can take walnuts, almonds. That is a good source for serotonin. Also, studies show that they are also beneficial for memory and cognition. They enhance the memory part of the brain. Then coming to appetite. Some people who are depressed eat low. They don't eat proper meals, proper quantity, and there's weight loss. So that needs to be addressed. Proper short meals, 3 times a day or 4 times a day is also good enough, so that you have the proper nutrition for your mental health and your physical health as well. Mindfulness is a technique that we as psychiatrists encourage. So mindfulness is a state of mind where you focus on the present. Not be worried about the future or the past, just be in the present. It can include mindful thinking, mindful eating, and all these also incorporate yoga, meditation techniques which you can do at home if you don't have the time to go out and do it on a daily basis, if you have like jobs, kids and etc. But that is necessary, is what we say to our patients. Now, maintaining a thought diary where you write your thoughts, bring it to the doctor and we go through it and we can assess which regions or areas we can help you improve. Now, pregnancy is also a part where we focus here at our hospital. We see several conditions such as, pregnancy blues, where the pregnant mother feels very low during pregnancy or even after delivery. For the first few hours and weeks, the patient may suffer from postpartum depression and severe forms of postpartum depression with psychosis. That is all treated with medications. So that is one key area where we focus as well. And we also help pregnant mothers with coping techniques. We give regular counseling to them during the pregnancy stage as well, and also for the stages after pregnancy if they're suffering from depression. And the child health, mental health is also important. So we teach the mother how to take care of the new infant, and if she is currently unavailable due to her mental illness, then we can teach the other caregivers such as the father, the grandparents or the other family members how to take care of the baby as well. Pet therapy is very good, where you can adopt a animal. It can be a dog, a cat, whatever suits you, or even a fish. And taking care of that animal can give you a sense of purpose, a sense of meaning in life, and a responsibility. And also it is like a dual benefits, because when you take the dog out for a walk, that is also physical exercise for you as well. The other aspect where I wanted to focus is suicide. Please understand that suicide is rampant in the Indian society. India statistics show that we are one of the highest numbers in the world for suicide. So please, if you have any negative thoughts or very self-harm thoughts, please do reach out to us. We have all the necessary techniques to help you out with that. Medications is also very, very, very needed in those situations. Like I said, one of the myth busters that we do here is no medication is harmful for you. We are the trained professionals and we know how to dose it for you and to help you come out of your problem very, very quickly. The other thing is the take home message would be, it's okay not to be okay. There is nothing to be ashamed of regarding mental illness. Be open about it, be accepting about it, and once you are accepting it, that is the first stage to progress. That is when you have already taken the step forward, and that makes our job very easier. And so if you have any questions, the number for the hospital will be below in the description. And thank you for your time and patience. I'm Dr. Vishnu GADE, consultant neuropsychiatrist at Kamineni Hospital, Koti, Hyderabad. Thank you.